What's up, everybody? This is Dr. Zach Baker, and you are listening to the Strength and Knowledge podcast. And we have with us today Dr. Abbey Hammann, one of our two sports residents here at Rehab to Perform, who treats out of our Frederick location. And this is crazy to say, but it is Abby's last month of residency. So she's on today. We've got two journal articles that she's going to review. One being more of a position statement, the other being more of a true article research review. But Abby, do you mind just taking a minute to name what the two articles were that you found, and which one do you want to start off with?
So the first article is the 2023 International Olympic Committee's consensus statement on Red S. Red S stands for Relative Energy Deficiency in Sport. It was previously thought that this was mainly just for female athletes, and the new consensus comes out with some great details on male athletes and also in para-athletes for the upcoming Paralympics as well. The second article we'll talk about is the effect of the FIFA 11+ injury prevention program in regards to collegiate level female soccer players, and it's going to look at that over a couple of seasons.
Awesome. Well, we are in the middle of the Summer Olympics right now, so let's start with the one from the IOC.
Awesome. So this article looks into Red S, or Relative Energy Deficiency in Sport. This, by definition, is a clinically diagnosed multifactorial syndrome, which is typically characterized by the accumulation of deleterious effects on health performance outcomes resulting from exposure to problematic LEA, which is just the shortened abbreviation of lower energy availability.
Awesome. And you said that they found this is not unique to female athletes.
Correct.
And they provided some updated recommendations or guidelines in its relevance in male and even Paralympics. Do you mind talking about that? Were they just stating that, hey, this is not only unique to females, or did they give any more detail into that?
So the idea behind this consensus statement is an updated version of the 2019 version. So each year before the two previous or current one in the previous Olympics, they've come out with a consensus statement just because they took a poll and a vast majority of coaches, clinical staff, and training staff have no idea what the signs and symptoms of Red S, or this is essentially the Red S is an updated version of the female athlete triad because it now includes male athletes, para-athletes, and is a little bit more inclusive because come to find out that, yes, some menstrual disturbances are a factor into some of the Red S components, which is going to be primarily for female athletes, but they also want to take into account how problematic lower energy availability is in regards to energy intake and energy output. Especially with training cycles versus in-season, off-season, and preseason, which preseason for most sports is a very tough grind to go through, and you're doing a lot of work. So are they trying to match their energy intake with the output, depending on what part of their season and what phase of life they're in?
Yeah, and I think that's important to categorize as growing up when I was going through undergraduate and through grad school, we still more commonly referred to the female athlete triad, identifying what that was, what the effects were from it, and just different recognition and management strategies. And like you alluded to, yes, that is a large part in understanding how those things unique to that can influence energy, performance, symptoms, how somebody feels, how somebody interacts on a day-to-day basis. But when you look at that from a more macro standpoint, if we're just talking about energy, and we're talking about performance, that's not unique to females. And obviously females will go through some things that their male counterparts will not, that will influence energy availability. But if we're just talking in regards to what Red S is stating, it is something that is a little bit more universal. And you can take some of those overarching principles and apply it to all athletes. With this, Abby, reading through the consensus statement, what were some big take-home messages that you, as a sports PT, really take away from the article, or what are things that you'll keep in mind moving forward when you're working with the athletic population?
So biggest thing for me is when they were taking some stats, less than half the coaches, physicians, and sports staff were able to identify even just the components of the female athlete triad, which is a much more simple, less complex essentially configuration than Red S is. And on top of that, with higher level athletes, 23 to 79% of females demonstrated low energy availability, and 15 to 70% males demonstrated this as well. So the numbers are pretty close to each other on that front. And then para research for Paralympic athletes is still ongoing, but it's estimated to be a lot more for those individuals just because of the nature of their basic physiological state. Biggest thing with this for me is just to be aware of the physiological indicators and psychological indicators that may present in an individual, because the prevalence and incidence is actually pretty high in the higher levels, especially collegiate professional sports. And with this, just having an idea what to be on the lookout for, but also looking at signs and symptoms of overtraining as well, because a lot of the lower energy availability signs and symptoms overlap with overtraining principles. So just having the knowledge where sometimes one can mask the other. So having a better understanding of that, because the approach to Red S is a multidisciplinary group. So you need a whole team involved. So I need to be best aware of when to bring in other people, such as nutrition or other further consults.
And I'm glad you brought up overtraining, because I think when we talk about Red S, when you talk about female athlete triad, we have to be mindful, like you mentioned, what are the physiological indicators? What are we actually seeing as signs, symptoms, or kind of these red flags that it may be present? Then the next thing you have to do is you have to figure out, what can we control? And there's certain things that we can control from a program design standpoint, from a nutrition standpoint, from a sleep and just self-care standpoint. And then there's other things that we have less control over from a biological standpoint. But we need to appreciate how they interact with one another. And we're going to have certain things from a biological standpoint be influenced by what we're eating, how we're sleeping, how much we're training, or how much or how little we're doing all of those. But then also appreciate there's going to be certain things that happen on a biological level that are going to interact with our ability to train, our ability to eat, our ability to sleep regularly and comfortably. So I think understanding all of the different components, and like you had mentioned, it's hard to interact, intervene, or even just manage these if we can't even define what it is in the first place. So as with most things in life, just a general understanding and being able to define and communicate what we are looking for and how we are going to objectively track it or subjectively measure it is step one. Then the next part is figuring out what's the most appropriate step to intervene, or if we can't intervene, how do we manage what we have in front of us?
Yeah, and with this new consensus, they came out with a new clinical assessment tool, which they're hoping to provide to a lot of the higher levels so that this can more easily be identified, which I think is pretty awesome. So I'm excited to see what in 2027, I'm assuming they'll release another consensus statement, what the update will be for the 28 LA games.
Awesome. All right, Abby, let's shift gears a little bit and let's go to the FIFA 11. And as a refresher, can you just say what the article was, and then can you dive into a little bit of just what is FIFA 11 for those that are unfamiliar?
Yep. So FIFA 11 was produced by FMARC, which is part of the FIFA Federation, and they came out with the FIFA 11 Plus originally in 2006. So it's been around for a while. It's been modified a couple times, but the idea was to have a 20 to 30-minute warm-up for soccer players to aid in injury prevention. And the FIFA 11 Plus is a lot of different things that you're doing. It's about 3 different groups. Each group is something a little bit different. So you start off with some running variations, and then you start with a strength, plyometric, and balance circuit. And then you follow that up with some higher level strength, plyometric, and balance activities. Ideally, you're prepping the body for what it's about to undertake in the level of your sport. So you're getting some plyometric contacts, you're doing some dynamic balance activities, and you're just kind of warming up your body in a more holistic way rather than going through a couple dynamic and static stretches. So the idea of this was to have people complete this and then see what the prevention rates were in reducing injury risk and rates.
And I think for those listening, the real backstory behind all of this is the realization and the data that showed a lot of injuries we have are non-contact, and we can't prevent all injuries. We can put people in a better position to make the likelihood of them happen less and less. And when we have non-contact injuries, it's often a result of inability to appropriately accelerate, decelerate, change position, and we put our body in positions where it's just more likely to take on unnecessary stress and strain. We can't control somebody landing on us. We can't control somebody tackling us funny. We can't control field conditions. But what we can control, or at least influence, is how well we manage our own body with movement. And I think that's really what the FIFA 11 was geared around, is how can we make sure from a mobility, from a strength, from a coordination, from a force production, power production, change of direction, how can we become more comfortable, more proficient, and more competent with it? And how can we also do that in a manner right before games where we're priming our system and prepping our body for that to happen? So, Abby, after reading the article, what were some of the big takeaways that you got?
So with this article being a non-randomized control trial, it had a couple limitations in regards to the population, but overall it was successful in finding out over a single season and then over 3 consecutive seasons what the rates of injury prevention were. In the study, the sports-related injury was qualified by an injury that caused an individual to miss out or 1 or more days of either competition or practice. And with this, they would go through the FIFA 11 plus 2 to 3 times a week. FMARC recommends that you do at least 2 times a week. 3 is optimal, and it tracked over time what compliance was throughout the study, in addition to what rates decreased. So they looked at lower extremity injury rates. Overall, in the first season, injury rates in lower extremity decreased by 66%. In regards to ankle injuries, it decreased about 80%, and then overall sprains, about 82%. Each year after that, there were additive effects. So the following 2 years, those percentages went up. So they looked at ankle injuries, knee injuries, sprains, ligamentous injuries of any sort, because those are the most common ones in soccer. And overall, they found that every single year, things were improving. People were getting hurt a lot less often. And it demonstrated positive findings in regards to FIFA 11 plus being added in. And it took 20 minutes, 2 to 3 times a week. And compliance was anywhere from 88 to 95%.
So what I get from this is it is beneficial to do some sort of preparatory work before competition, and it's probably even more beneficial to have structure and consistency to that. And I think oftentimes people worry about finding the perfect program or the ideal program, and when you actually ask them, well, what are you currently doing? They can't even answer that. And they have inconsistency with, one, are they doing anything as a warm-up or anything as preparatory work? And then if they are doing something, does it have any sort of rhyme or reason as to how it is? So I've always been a fan of the FIFA 11, and really more so because I'm a fan of things being predictable and things being consistent. And I think it provides a very easy framework for people across a variety of levels to be able to take this program and implement it, and it's pretty plug and play. From a coaching standpoint, it removes the decision-making of what should I do with my athletes. You can literally just take this and implement it. From a medical, health, fitness, wellness standpoint, it's something that has been looked at in the literature. It has some backing to it. So you can do it confidently knowing, hey, this has some substance to it. We're not just arbitrarily putting things together and hoping that it works. This is something that has been tested and it has shown to have positive outcomes with it. Abby, any big takeaways on your end? You've been practicing for a year now. You're about to wrap up residency. You've worked a lot with a wide variety of athletes, especially in the youth, adolescent age, and even into collegiate as well. When you read articles like this, is there any big things that come to mind for you?
I think biggest thing for me is, like you mentioned earlier, is that consistency. So with a lot of my athletes, they're doing the very same warm-up every single time. If we're doing something different that day, we might add something a little bit different to their warm-up. But traditionally, locomotor tasks, mobility, we're doing pretty consistently in any like plyometric, pre-plyometric warm-ups. We're doing those as well. And I think that's helpful, especially with the younger ages, to kind of coach them into, hey, you're here, we're ready to get started. You know your warm-up. And it also provides a sense of autonomy and independence for them as well, which I think translates into their training into the later years as well. So I think it's beneficial at building not only injury prevention with some of the stuff where you're doing some familiar tasks beforehand, but also creating that sense of autonomy, which I think is a really big deal for youth athletes nowadays, especially with how popular travel, soccer, baseball, lacrosse, all of those things. I think that's especially important for those kids, especially because coaches nowadays, some of them are very good. Some of them are just volunteering just to volunteer. So I think it's helpful to have a little bit of help on the side in regards to injury prevention. If we can help that on the back end, I think that's pretty beneficial.
Definitely, and I don't want people to confuse consistent with monotonous. And everything that you had mentioned of creating familiarity with a warm-up routine, you're really looking for consistency amongst themes. And you had talked about locomotive, plyo, strength, things along those lines. You're always hitting the same buckets and you're hitting the same themes, but there is some variability with regards to the things that you're doing within each one of those themes. So I do want people not to confuse consistency with meaning you just do the exact same thing for the rest of your life, but it's making sure that what we're doing from a warm-up matches the characteristics of the competition that we're about to go into, and then the actual activities that you're putting in there, as long as they're staying within the confines of those buckets of needs, they can be relatively interchangeable. So, Abby, as always, thank you for the time and attention on this. And it's hard to believe that we're wrapping up residency, but thank you for your contributions all year long with this. And for those listening, this is the Strength and Knowledge Podcast. Stay tuned for next week's episode.